Before starting to use Golimumab, make sure to read the medication guide provided by your pharmacist, and ask your doctor or pharmacist if you have any questions. This medication is given by slow injection into a vein by a healthcare professional, typically over a 30-minute period. After the first dose, it is usually given again 4 weeks later, then every 8 weeks as directed by your doctor. The dosage is based on your weight, and for children, it is based on their body size. It's important to receive this medication regularly to get the most benefit from it. To help you remember, mark your calendar to keep track of when to receive the next dose. Be sure to tell your doctor if your symptoms do not improve or if they worsen. If you experience redness, irritation, or pain at the injection site, make sure to inform your doctor or pharmacist. Remember that the benefit of this medication outweighs the risk of side effects, and many people using this medication do not experience serious side effects. However, it's important to tell your doctor if you notice any serious side effects such as easy bruising/bleeding, numbness/tingling, unexplained weakness, vision changes, joint pain, rash on the nose and cheeks, symptoms of heart failure, signs of infection, or symptoms of liver damage. Seek medical help immediately if you experience chest pain or seizures. Golimumab may cause a rash, and it's important to seek medical help if you develop any rash. Although very serious allergic reactions to this drug are rare, seek immediate medical help if you notice symptoms of a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so make sure to contact your doctor or pharmacist if you notice any other effects. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before starting Golimumab solution, it's important to let your doctor know if you have any allergies or if you are allergic to any inactive ingredients in the product. Also, be sure to discuss your medical history with your doctor, especially if you have any blood or bone marrow problems, nerve disorders, cancer, heart disease, lupus, seizures, or if you have had recent or repeated infections. Golimumab can increase your risk of getting infections or make current infections worse, so it's important to avoid contact with anyone who has an easily spread infection such as chickenpox, COVID-19, measles, or the flu. It's also important to let your healthcare professional know that you are using Golimumab before getting any vaccinations. To lower the chance of getting injured, be cautious with sharp objects and avoid activities that may result in injury, such as contact sports. If you are planning to have surgery, be sure to inform your doctor about all the medications and products you are using. If you are an older adult, you may be more sensitive to the side effects of this drug, particularly the risk of infections. If you are pregnant, discuss the risks and benefits of using this medication with your doctor. For mothers who have used Golimumab during pregnancy, it's important to talk to a doctor about immunizations for their newborn babies. It is not known if this drug passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Golimumab solution. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Certain medications, such as other TNF blockers or drugs that weaken the immune system, may interact with Golimumab solution. Additionally, it's important to avoid treatments that contain live bacteria or viruses, as they may increase your risk for serious infections while you are using Golimumab solution. Be sure to discuss any concerns about drug interactions with your doctor before starting or changing the dosage of any medications. If someone has taken too much Golimumab solution and is experiencing severe symptoms like loss of consciousness or difficulty breathing, it is important to seek immediate medical assistance. In the US, you can call 911 for emergency help or contact your local poison control center at 1-800-222-1222. Canadian residents should call their provincial poison control center. It's important not to share your Golimumab solution with anyone else. Before starting and while using this medication, you may need to undergo certain lab and medical tests, such as complete blood counts, liver function tests, skin exams, and TB/hepatitis B tests. Make sure to keep all your medical and lab appointments and consult your doctor for more details. If you forget to take a dose, make sure to consult your doctor or pharmacist for guidance on when to take your next dose. This medication, Golimumab solution, is administered in a hospital or clinic and is not meant to be kept at home. It is used to treat certain autoimmune conditions such as rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, and ulcerative colitis. The dosage and frequency of administration will vary depending on the individual's condition and response to the treatment. It is important to follow the healthcare provider's instructions regarding the appropriate dosage and timing of the medication. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.